So my name is Juno Duenas, and I live in San Francisco. I have 4 children who are grown, mostly moved out, 2 at home. One of them is Marjorie, who is 24 years old and is severely disabled. She has an underdeveloped brain, quadriplegia, no self-help skills, needs 24/7 care. She's now facing medical issues, and we're really not sure what the outcome's going to be. Having said that, my daughter is not a tragedy. She is a spectacular human being. We love and cherish her, as well as many other people in our community. The challenges are really with the services. Moji, we're lucky and we're blessed because we have resources. I'm fairly articulate depending on my mood. My husband is also a very good advocate, and we have been able to, both of us work full-time, and we're able to bring resources in our home so we can support her, as well as depending on government agencies. We have the regional center that provides aids for us so that when we're working, we have support for her at home, as well as in-home support services. My daughter's not in a day program. She's not in a program that she goes to. We actually have aides come in the home because she's medically fragile right now, and it's better for her situation. Basically, the regional center pays for them from 8 to 4. I leave the house at probably 7 o'clock in the morning and don't get home till 8 at night, so IHSS covers the other hours. And then IHSS service hours, they're talking about cutting some of the service hours for non-medical support. Well, Moji, she can't feed herself, she can't change herself. So if they cut back, it means that either my husband or I are going to have to quit our jobs and take care of her because she can't do it herself. It's just the way it is. The cuts, if they came down, well, the fact that medi-cal rates are so low already impact us. It's really hard for us to find providers for her, because she's so complicated. A lot of people know, doctors know right off the bat, the kind of care she's going to need to take. I think it took us a year to find a neurologist. She had been dropped by 2, and it took another year. And she was in crisis, going to the emergency room every few months. It was really traumatic not having a neurologist during that period. We have one now. So if they decide to go ahead with the redetermination for medi-cal every quarter, the amount of paperwork that families like myself already have to do, we have to do paperwork for when our children are in school. We have to deal with the Calfornia Children's Services. We also have to do paperwork for the regional center. And the idea of having to do a report or respond to paperwork again 4 times instead of 1 time is overwhelming. It's a huge burden. And it's hurtful to have to be asked over and over again, so does your child still qualify? Well, my daughter has not been cured. Chances are she's never going to be cured, so why do I have to keep answering these questions? In addition, I just have to say on the side that the only reason they would set something up like this is to try and get people to be dropped. It's not going to cost the state less money if they do quarterly redeterminations for everybody. If everybody actually responded, it would cost more. It seems like people with disabilities, people who are low income, are going to be most affected by this, what sounds like across-the-board cuts. My daughter is going to be impacted by most of the cuts that are going to happen, and it seems unfair.